My name is Viola Davis, and today I'm going to be talking about Tourette syndrome. Tourette syndrome is defined as a disorder characterized by both vocal and motor tics. Tics are repetitive, brief stereotypical movements or vocalizations. Examples are eye blinking, head jerking, yelping, shoulder shrugs, sniffing, grimacing, and making grunting noises. The etiology of Tourette syndrome, it is both a biochemical and environmental inherited brain disorder with biochemical differences. Usually there's an excess or oversensitivity to dopamine. 50 to 70% of cases of Tourette syndrome are genetically based. The prevalence of Tourette syndrome is 1 in every 360 children ages 6 to 17 in the United States will have Tourette syndrome. Boys are affected 3 to 5 times more than girls. Tourette syndrome does not discriminate. It affects people of all racial and ethnic groups. Tourette syndrome can be a co-occurring condition. 86% of children diagnosed with Tourette syndrome also have been diagnosed with at least one additional mental health, behavioral, or developmental condition. Conditions such as ADHD, behavior or conduct disorders, anxiety, depression, autism spectrum disorder, learning disabilities, speech or language problems, intellectual disabilities, developmental delay, and obsessive-compulsive disorder. Behavioral characteristics. Most children with Tourette syndrome develop tics in a sequence: eye tics, facial tics, or involuntary sounds, and then other tics. Tics can change over time and can vary in frequency and type. Sometimes tics can be regarded as a non-compliant behavior. Social and emotional characteristics. Children with Tourette syndrome experience social and emotional difficulties in their daily lives. Children with Tourette syndrome are often teased, embarrassed, belittled, or made to feel unwanted by their peers due to their tics. This can cause for depression and anxiety in children with Tourette syndrome. There's also a risk for aggressive social behavior or to the student to become withdrawn. Cognitive characteristics are most children with Tourette syndrome have normal intelligence and IQ scores. Perceptual, motor, physical, and somatic characteristics. Some children with Tourette syndrome may have visual perception and visual motor problems, such as tics occurring during handwriting. There are simple and complex physical and motor tics. Simple tics include blinking, neck jerking, kicking, swinging, tapping feet, and tensing muscles. Complex ones are usually facial gestures. Rarely are tics self-injurious, such as biting. There may also be a need to perform actions in a sequence, such as touching an object or touching others. Academic characteristics. Some tics may affect handwriting due to the control of the muscles needed. Daily activities such as writing an agenda may become difficult to complete. Tics may also occur if a student with Tourette syndrome is stressed about the work given. If a student struggles in math, tics may become more pronounced during math instruction. Next, we're going to go with impact on instruction. Fewer tics are experienced when a student is presented with a task of interest. Teachers need to stop peer teasing, educate peers, and model acceptance for students with Tourette syndrome. Allowing for short breaks with education will help with tic control, as will breaking assignments into manageable chunks. Giving students resources such as an iPad with apps such as TalkTyper, or allowing students to give reports verbally. Provide a private space, such as a sensory room, where a student can go for tic release. Impact on the home, life, and family. Tics become prevalent when there is more stress in a child with Tourette syndrome's life. It is important to talk to your child and other family members about Tourette syndrome, letting them know they are not alone. Joining support groups such as Tourette Syndrome Association is beneficial for both the child who has Tourette syndrome and the family. Finally, we're going to discuss the classroom environment. To help a child with Tourette syndrome become successful in the classroom, the following suggestions are recommended. Hands-on activities. Directions posted on overheads and chalkboards. Assignments given in small chunks. interactive class discussions rather than teacher lectures, consistent schedule posted in the classroom, and flexibility in the schedule to allow for breaks. Thank you for listening to my presentation about Tourette syndrome. Again, my name is Viola Davis. Thank you.